Hello, and welcome to Nephrology Nursing Perspectives, an official podcast of the American Nephrology Nurses Association. This podcast provides interviews and discussions between members of the American Nephrology Nurses Association and the nephrology community, and will focus on nephrology nurses' issues, health policy, and nephrology nursing as a specialty nursing profession in the areas of conservative management, peritoneal dialysis, hemodialysis, continuous kidney replacement therapies, acute kidney injury, transplantation, vendors, government and regulatory agencies. In April 2021, and under the direction of the American Nephrology Nurses Association's Leadership Committee, chaired by Ms. Nancy Pierce, the association launched the Way into Nephrology Nursing webinar series. This series is designed for the student or new-to-practice nurse who is interested in learning more about nephrology nursing. Facilitated by Leadership Committee members Dr. Jami Brown and Dr. Paulus, this episode provides the conversations from the inaugural episode of the series. You'll meet some nephrology nurses and hear about the benefits available to you from a professional nursing association. We are pleased to present these conversations from the first Way into Nephrology Nursing webinar.
Hello, everybody. My name is Janet Betts, and I'm from the ANA National Office, and I welcome you. Thank you for joining us tonight for what we hope will be a very fun, informative webinar. I have two wonderful ladies here to introduce to you, Dr. Paulus and Dr. Jami Brown from our ANA Leadership Committee. Both are committed to helping students and younger nurses, and so it's our pleasure to be here with you and to present our very first Way into Nephrology Nursing webinar. So with that, I'll turn it over to you, Amber.
Okay, thanks so much, Janet. So I am Paulus, and Jami and I are pleased to be with you tonight to share some insights into nephrology nursing, why we chose nephrology nursing, and how you might be able to do the same. So a brief overview of what we do. We are the American Nephrology Nurses Association, and the only organization that specifically serves nephrology nurses. And we work in all practice settings, kind of across the spectrum of healthcare, in hospital acute care units, hospital acute dialysis units, outpatient chronic dialysis units, home training dialysis centers, centers located in long-term care, transplant centers, outpatient nephrology provider practices, also in colleges and universities and nursing schools, as Jami does, and then business and government, as I currently do. So because this field that we work in is so diverse, but also growing at a rapid rate and changing so often, we want to share with you why we love nephrology nursing as a career. So we've asked some of our colleagues, Jami and myself included, to give some perspective on what it is like to be a nephrology nurse. So Jami, I turn things over to you.
Sure, thanks, Amber. Well, I first of all became a nephrology nurse. Actually, my father, he was diagnosed with kidney disease, actually my freshman year of college. And even from there, for nursing school, I had an awesome nursing professor who's also a great mentor, who's also actually a past president of ANA. Well, after that, from graduating nursing school, I went to be a staff nurse in the medical ICU. And then later, I transitioned to be a peritoneal dialysis educator, then also a hemodialysis nurse. And currently, like Amber mentioned, I am a nursing professor, and that job it just makes me happy just to teach nursing students, all about nephrology, the kidney, CKD, AKI, some of everything. And even regarding serving on ANA, I serve also on various committees, such as the Research Committee, Leadership Committee, and also I'll be upcoming the Educator Specialty Practice Network leader. So overall, for me, nephrology is awarding and also satisfying.
So I would echo what Jami is saying. The interesting thing is both of us, I think we both started in a medical setting in the acute care setting. I did as well on the progressive care side. And as soon as I started that position, I made it a priority to get plugged into my unit. I think often, we'll work the 3 or 4 days that we're assigned for a week, and then you kind of disassociate with the work environment as you go on about your life. I was looking for a way to really get plugged in. So I started the clinical ladder program. That afforded me some different opportunities that came along with progressive responsibilities. I became a charge nurse on my unit, then took over a clinical team leader role, and just got really involved. I joined the research committee representing my unit. I led quality improvement projects from the bedside. We used to call that TCAB, transitioning care at the bedside. That turned into CIT, care innovation transformation. And that, for me, really changed the trajectory of my career. I loved working in the acute care environment, and I specifically enjoyed taking care of patients who had chronic kidney disease. A lot of my patients came in with a cardiovascular diagnosis, which is the highest mortality rate of patients with kidney disease, followed briefly after infection. So that was a lot of the population that I was serving. And I found it to be challenging, but I also found it to be rewarding because not all of my patients had end-stage renal disease, meaning that they required dialysis or had to consider a kidney transplant. So there was still time to make changes in the trajectory of how their kidneys were going to function. And seeing them really get it was very fulfilling. Following that, I moved full-time into quality improvement work, working specifically in dialysis facilities. That work's funded by Centers for Medicare and Medicaid Services. And if you're aware of how that program operates, Medicare is a primary payer for patients with end-stage renal disease. So they care a lot about the quality of care delivered to a patient population. And I've just kind of progressed through that work. And now I'm the director of data science and lead government contracts and research that's relevant to kidney disease. And I also find it to be very rewarding, like Jami described. It's different every day. And so that's what keeps it exciting. And I can't imagine doing anything different at this stage. So hearing from us, we will turn to our colleagues who also want to share about their roles in nephrology.
Hello, everyone. My name is Danielle Anchia, and I'm a nephrology nurse and a member of ANNA Dallas chapter here in Texas. I started my career back in 2002 as a dialysis technician and later became a staff nurse, a dialysis nurse. I've been able to work in many different settings, including outpatient in-center hemodialysis, peritoneal dialysis, nocturnal dialysis, and home health pediatrics. And I have since advanced to currently being the Clinical Quality Improvement Director for the ESRD network of Texas. We are a federal government contractor. Being a nephrology nurse and part of ANNA has actually presented me with numerous opportunities to grow as a professional and to network with other ESRD professionals as well, which in turn has actually helped me advance in my career. I'm very proud to be part of such an incredible specialty, and I'm looking forward to many more years of improving patient care, number one, but also continue to thrive as a nephrology nurse and continue to advance in my career.
Hello, everyone. My name is Nikita Davis, and I'm a nephrology nurse. I'm also a member of the Michigan 312 chapter in Michigan. I love being a nephrology nurse because this field provides a career ladder. I've been in nephrology for about 21 years, started my career out as a dialysis technician, and now I'm a newly certified nurse practitioner. My current practice area is home dialysis, where I teach patients how to either perform peritoneal dialysis or hemodialysis at home. It makes me happy that I can bring joy to my patients' lives by providing them with the tools to perform self-care and involve them in the management of their kidney disease. Please consider a career in nephrology nursing. You'll be rewarded in many ways.
Hey, what's up, everyone? My name is Faith Lynch. I'm a nephrology nurse and a member of the Long Island chapter of ANNA located in New York. I can tell you that I absolutely love nephrology nursing. And I say this with so much sincerity because I'm a prime example of someone who graduated nursing school, and my first job was in a dialysis unit. And we're going back almost 15 years, and I am still in nephrology nursing today. For me, what drew me to it was the variety in the daily routine, because no day was ever the same. It was unpredictable. So it kept me interested. And also the work environment was challenging, but in a positive way, because as a nurse, I got to utilize my critical thinking skills to take care of this patient population. I also loved the relationships that I developed with the patients in my dialysis unit, because you don't develop relationships like that in any other areas of nursing other than in a specialty like nephrology. So overall, nephrology nursing is very rewarding, and it provides you with a foundation of developing good relationships with patients and your coworkers. And the environment is so built off of teamwork that if that's what you're looking for, nephrology nursing is a specialty for you. So now when it comes to ANNA as an organization, they have helped me as a nurse soar to new heights in the professional world. I can't say anything other than how amazing and supportive and resourceful this nursing organization is. Everything they do is focused on what's best for my members. They've given me as a leader and as a nurse multiple opportunities to grow not only professionally in my career, but also to grow within the organization as a whole. And I'm really proud of what I've accomplished so far. And I can't wait to see what I'm going to do next as a nephrology nurse in the future.
Hello, everyone. My name is Tanya Scott, and I'm a member of the ANNA Gulf Coast chapter in Houston, Texas. I enjoy being a nephrology nurse because it has allowed me the opportunity to care for patients and families affected by kidney disease. On a personal level, kidney disease has affected many members of my family. I appreciate every nephrology nurse who has touched my family members and made a difference in their lives. I am fulfilled by knowing that I am helping to improve the quality of life of those affected by kidney disease. ANNA has helped me become a better nephrology nurse, mentor, and leader, and I have touched so many more due to my involvement with ANNA. ANNA has also helped me advance my career and develop lasting professional relationships with many nephrology nursing trailblazers. ANNA is a professional organization that performs at the highest standards, and I am proud to be a member and leader in this organization. I am proud of my personal and professional accomplishments, and I expect to continue on an upward trajectory in my career.
Hi, everyone. My name is Laurie, and I'm a nephrology nurse and member of the Alamo City chapter of ANNA in San Antonio, Texas. I love being a nephrology nurse because I get a chance to interact with every patient on a level most people do not understand. I always knew I wanted to be a nurse, but I had a strange jump into it. My son was born when I was at a young age and was taking prerequisites in college to get into nursing school. Before he was 2, he was diagnosed with focal segmental glomerular sclerosis, or FSGS. To make a long story short, he eventually wound up on dialysis and then got a kidney transplant when he was 6. Seeing all the wonderful nurses who adored him made me want to be able to give that same kind of care to other children. During nursing school, I joined ANNA and found an abundance of wonderful mentors and began my journey into my position in nephrology nursing. Luckily enough, I found a position at the very same clinic where my son had received such wonderful care. Fast forward to today, and I get to save children's lives, live out what I really feel I'm called to do, and I can lend support to the new parents I meet and help them understand. Along the way, ANNA has helped me advance in my career. I'm extremely proud of what I've accomplished so far and expect to go to great heights as a nephrology nurse.
So Jami and I will echo what our colleagues are saying about the resources afforded to us through ANNA. Jami and I actually met through the leadership roles that we serve on the research committee to start. Now we're both on the leadership committee together, as well as our individual state chapters that we're a part of. But it truly changed the trajectory of your career when you find an organization that will support you in your specialty, but also provides resources as you continue to make career changes, as Jami and I have done, throughout the years that we have been practicing as nurses. Definitely, as one of our colleagues said, nursing trailblazers are in this organization and willing to come alongside you as you navigate your way through the profession and the specialty. So I turn it back over to Jami to share some of the resources that ANNA offers for students specifically.
All right. Thanks, Amber. So as you can see, we have a free ANNA membership for the student nurse, and we have the link provided. So please, y'all, go out and join today. So some benefits of the ANNA student nurse membership. So, hey, you get free 1-year membership for students. You also get a free electronic attendance at our national meetings, such as our fall meeting and also our national symposium. And then, of course, you can network in the ANNA Connected, which is basically an online community of nephrology nurses. And as nephrology nurses, we love to connect and network with others. Also, you get access to our digital edition of the Nephrology Nursing Journal, which is the only journal sponsored by ANNA. Then you also get free C&Es. Who loves free C&Es? Opportunities in the ANNA online library. And then you also get the chance to attend your chapter's local events. And as you have heard from the various speakers, there are lots of chapters. And then lastly, you also get mentoring. Like I even mentioned, I had a nursing professor who was a mentor for me. And I even have mentors throughout even my career, even now. But you get a mentor from actually those seasoned nephrology nurses. So what does ANA also offer? Well, it offers a leadership toolkit for the novice nurse. In the leadership committee, we have developed a leadership toolkit for the novice nurse. And as you can see, that there are 7 resource sections based upon that you can look at regarding the leadership toolkit for the novice nurse. And this here is also free to student nurse members. So mark in your calendars that Nephrology Nurses Week, it is September the 12th through the 18th. And this year's theme is Still Like Air, I Rise. So mark it on your calendar to celebrate Nephrology Nurses Week. So who does not like scholarships? So be sure to go out. There's a scholarship offer for RN and also our APRN students. So hey, APRNs, we did not leave you out, to attend the national ANA meetings. And then another thing to mark in your calendar. So we have the Hollywood Beach, Florida. It's going to be our next symposium for the fall meeting, I should say, for the Nephrology Nursing Practice Management and Leadership Conference. So, hey, we all been in quarantine. So even now we have an ANA conference meeting that will be held in Florida. So also mark that on your calendar. And then our ANA National Symposium. So it is planned for next year, face-to-face, May the 22nd through the 25th in actually Fort Worth, Texas. So once again, save that to your calendar. So save the date. Transition from all those things that you marked in your calendar. Hey, we know you're nursing students and you keep a calendar handy. But moving on to the next topic. So there are actually a nursing care of the patient with kidney disease in any setting. So there are modules out there that you can view, such as an overview of CKD, which is chronic kidney disease, the various stages of CKD, stages 1 through 5. Also, you have kidney replacement therapy, palliative and end-of-life care for those patients who have kidney disease, and then also even acute kidney injury. And then one of our other modules in that CKD module is the pediatric patient who has chronic kidney disease. These series of modules here are very beneficial regarding helping to learn more about CKD in any setting.
So I'll echo what Jami's saying here. As a nursing student, the reason why we're pointing this out is if you're interested in nephrology and say you learned this in med-surg a couple of semesters ago, so it's not necessarily fresh in your mind, but tell me again about like treatment modalities or why patients who have end-stage renal disease should consider home dialysis or transplant, or what does that look like? This is a great resource to get an overview of if I was practicing in XYZ setting in nephrology, what kind of work would I be doing in that setting? What would my kind of day-to-day tasks look like? How would I be educating patients? What would be the priorities in that particular setting? So that's why this particular resource is being pointed out.
Stay tuned for other further webinars for students. We have one September 2021 and also October of 2021. So even talking about we love nephrology nursing and you will too. And then also talking about the career of a lifetime. So regardless of which one that you want to attend, please come and join both of them if you can. As you heard some of the various speakers talk about their actual local chapters. So as you can see, there are 80 local ANA chapters around the U.S. I'm a member of the Memphis Blues chapter. And how about you, Amber?
A member of the Old Dominion chapter right there in the middle of Virginia.
Okay, gotcha. So as you can see, there are tons of chapters located in the U.S. And like we also mentioned regarding the ANA free membership for students, you get to attend your local chapter meetings that's held in your area.
So I think with that, we will open the floor for question and answers. So if you have questions, we have some panelists that will be joining us as well, some of our colleagues from the leadership committee. So maybe to kick things off, Jami and I had a few questions that were sent to us prior to this, and so maybe we'll answer just a few of those while you all think of some of your questions that you might have. So I'll start with this one. Jami, feel free to chime in. The question is, are there jobs for travel nurses in dialysis? So in today's world, I think it is interesting about travel nursing. When I was graduating from nursing school, nobody was talking about travel nursing. We were just trying to find local jobs and maybe, moving. If you went to school somewhere else than you lived originally, you were moving back to home. So looking for a job there. So definitely today's world, still in the middle of a pandemic, travel nursing is definitely a hot commodity, and there are definitely positions available in travel nursing. I'm not sure, and Jami, you might know something different about this, if travel nursing would be the greatest transition for a new nurse to jump right into, having a little bit of experience prior to changing settings very frequently might feel overwhelming, as you're learning the ropes. But it's still a pandemic, so I think there's still opportunities that would be available out there. I'm just not sure about the experience level that would be required.
Yeah, I would also say the experience level might be the concern for the travel nursing, especially, that new grad, but, get a few, months under your belt. So you should be able to, especially like you mentioned, we are still under a pandemic, so they need nurses.
Staffing resources may be a little bit different than they have been historically. So I think it could be an option for sure to consider as well. One of the questions that came through the Q&A asks, what is the best way for a new graduate nurse to begin a career in nephrology? So I think Jami and I probably demonstrate that there are various ways to go about it. She started in medical ICU. I started in the medical PCU. Our setting was not necessarily specific to kidney at that time, but we transitioned, kind of niched down into kidney-related environments from there. I think it's probably beneficial if you're moving into like an outpatient hemodialysis setting or home setting. ICU experience is probably it translates very well. What would you say about that, Jami?
Yes, I would definitely say the same because, going to ICU settings, I've had several patients, that have acute kidney injury or, even come in with CKD and et cetera. Or then also think about some of the other settings, maybe let's say some hospitals, have a renal floor. So there are some hospitals, even like in my area, they have a specific renal floor that has like renal patients. But even like from a med-surg standpoint, even trying to learn about CKD as a whole will also be beneficial. So I would definitely even say to piggyback even upon all of what Amber has said, still check out those CKD modules because like they are mentioned, it's for a CKD in any setting, whether it be, on the med-surg floor, in the ICU setting, pediatric setting, in-center, home dialysis, transplant, etc.
Right. So to clarify on the travel nurse question, one of our colleagues who's in the chat was saying that when she would request for travel nurses, she would always ask for a year of experience. So I think it is probably wise to not let that be your first consideration when you're thinking about jobs post-graduation, but maybe with a year of experience or so, it could be a consideration. I know plenty of folks that I worked with who moved into travel nursing because they wanted that experience of living in a variety of different places. It also really gives you some perspective on the way we deliver healthcare in America and just how drastically different it is from setting to setting. So it's something to consider with a little bit of experience. So this might go with another question that we have. I started clinicals last week in the transplant unit, gave me exposure to dialysis unit as well. One of the other questions that we were asked is, what is a career path for a kidney transplant coordinator? So this is another position where you would have to have some experience. But if you're thinking about, I think when you're graduating, I think Jami would agree with this, you already kind of start to formulate either what your career trajectory might look like from an education perspective, like, am I going to go back to school to get a master's degree, whether that be an NP role, or you might be interested in like administration leadership, and there's roles for that. nurse educator, whatever it is you might have in mind that you kind of have an interest in already, you might be thinking more downstream, like if I get experience on a PCU or even, graduate, go right into the ICU, and you find that specialty that you really enjoy, looking down the line of what other opportunities might be available. A transplant coordinator could be one of those. I think you can also grow right into, depending on how big your hospital is, if you're working in a hospital setting, a transplant unit or post-transplant unit, essentially the step down from the critical unit. And so coordinating on the side of kidney transplant is ensuring that patients who are on a kidney waiting list, so we have a national wait list in this country, and it's maintained through a registry. Patients go through a screening process that requires several appointments. We're actually working on trying to make some of those appointments available through telehealth visits so that the patient doesn't have to travel back and forth as much. So your role is really making sure that all those boxes are checked. The patient maintains an active status on the wait list so that they can be matched for a kidney when a kidney would become available for that particular patient, usually cadaver kidneys, meaning that there was a kidney that was donated for whatever reason that patient were to pass away. You would coordinate as well with patients who come to you sometimes preemptively, meaning like before they are requiring dialysis treatment. Maybe they've been seen in a nephrology setting and they say, hey, I have a living donor. It could be someone that is their relative, and you would coordinate their transplant as well. So that is another career option in the nephrology setting. It kind of ties to that particular comment. Another comment, many states have regulations regarding dialysis experience. That is true. There is also federal regulations around what exactly you can do in dialysis, not so much around working in an outpatient hemodialysis unit, but in order to work in home training, you need experience in hemodialysis and 3 months of experience. So 12 months of experience in the outpatient setting, 3 months of experience on the home modality in which you would train patients. So we have home hemodialysis and peritoneal dialysis currently as options in the home setting. So those are federal regulations that would mean you need some experience before you can move into those settings.
Even talking about the nurse practitioner. So even thinking about still certain states allow, FNPs versus, acute care or general NPs or, acute care or primary care NPs to do certain things also regarding state and federals.
Right. So here's something else I will say about the question was asked, how long does it take to be a nephrology nurse? I want to create a dichotomy around this. Here's one thing to consider. Depending on where you live, like if you live in a very urban area and there are large hospitals in your area, think like Mayo Clinic, that's just the first one that comes to my mind, but there are several like that are very large hospitals. They will really dissect down their units. So they can go all the way down to just organ-specific units. So you can actually have a kidney unit that just sees kidney patients admitted to that unit. And so you could graduate and go on essentially a PCU kidney unit and be a nephrology nurse post-graduation. I think the thing we want to emphasize is you're a nephrology nurse when you're taking care of kidneys. That doesn't mean always directly. When I started in a medical PCU, not all of my patients had a kidney diagnosis, but we were very concerned about their kidneys because they had cardiovascular diagnoses that were bringing them to me. And I worried a lot about their kidneys. We were already having issues with their heart. Typically, if they had cardiovascular disease, they were in some stage of chronic kidney disease, not necessarily failure, but their GFR or the metric that we used to evaluate their kidney function was not greater than 60. It wasn't perfect. And so we were considering other organ systems as well as we made clinical decisions with the physician team. Let's jump to one other question that we have that we've received, and we'll go back to the chat. As a new nurse, when I look for a job, how would I look for a job with dialysis training? So, Jami, do you want to give a little bit of background on when you transitioned out of the ICU into hemodialysis, how training went for you?
Sure. So like I mentioned, I went from the medical ICU straight into peritoneal dialysis, being the educator, but I had like extensive training regarding that, everything from learning even more about PD than what I did learn it back in undergrad and even, during my master's program. So I learned, about the various types of fluids, the renal diet. So even from the peritoneal dialysis standpoint, I learned about PD or peritoneal dialysis. I also learned about hemo when I transitioned to a hemodialysis nurse. The company I work for, they send me to conferences and workshops to try to get a thorough understanding of what to do and how to take care of a patient undergoing dialysis. Everything from setting up the machine, learning the machine, teaching patients about the machine, and etc. So I had really a extensive training before I delved deep into dialysis nursing.
Right. I would agree with that. So in the same way that when you graduate nursing school and choose what your first job would be, let's just say it's in the inpatient environment, working in a hospital, you'll go through orientation as well. So similar to how when you have your clinical rotations, maybe that first couple of days, you're just trying to like learn and figure things out, like where things are on the unit and how the workflow goes during the day. Same thing will happen. There'll be an orientation period. You'll have benchmarks, milestones. You have to get checked off on certain procedures before you could do them solo. That same type of thing would exist. There's a lot of education sessions, that orientation session as well, because dialysis is very technical. And unless you rotate through a dialysis unit when you're in nursing school, I don't know that you're always exposed to like the technicalities of the dialysis treatment. So having that hands-on training is a big part of orientation in that setting. So let's go back to the chat. I think the question here with this comment is, what is the requirement to become a CNN? Because in this person's country, they are a nephrology nurse specialist. So the CNN is actually run by, I think it's the NNCC, Nephrology Nursing something Commission. And there, you can go to that website and it will tell you what the requirements are. I don't know that there is anything in there that says you can essentially cop the test or what we would call CLEPing, which means you don't have to take the exam. You would just bring your credentials and then be recognized as a CNN. I don't think that exists. So you probably have to you have to apply for the exam, show that you meet the requirements, meaning you have, it's a little over 2,000 hours worth of experience, and it's been within the last 2 years, I think is what the time limit on that is. But anyway, on that website, it would tell you to sit for the exam after you have applied. It will allow you to register. But given your experience, I think you will do fine, on that particular exam. I know Jami has that certification as well. I think you will do just fine getting that credential. So another comment about new grads coming into the hemodialysis setting, 100%. As Faith told you in her recording, she went right into the hemodialysis environment. That is definitely happening more and more frequently. I think probably historically it wasn't as common. Everyone wanted you to have some nursing experience before you came into that setting because you are in an outpatient setting, so you have to have a lot of critical thinking skills. However, I think the environment is such now that you have access to resources that you will do just fine graduating and going into the hemodialysis setting. So definitely open to new grads. All right, so let me go back to another question that we received. Where would I look for an entry-level job working with kidney patients in a hospital? I think we touched on this just a little bit. As your hospitals get bigger and bigger, they will subspecialize their units to sometimes be kidney units. Mm-hmm. So you could look there for, I think it would probably be a progressive care unit. You could see kidney med-surg units, but I think it would, given the prevalence of cardiovascular disease in this population, I would see them being on a monitor for the most part when they're in the acute environment. If something really acute is going on, because potentially they would have a potassium issue, it makes sense they'd be on a monitor. So you can look for things like that, progressive care units, kidney specialized units, anything cardiovascular. You're going to see a large kidney disease population coming onto that unit. ICU settings, because you can run CRRT in the ICU settings. That's probably more common now than ever. When patients come in and have multiple system failure. I don't know, Jami, what are other entry-level jobs?
I guess some others might be like transplant units. From a peds standpoint, I do not do peds, but I do know, they have like pediatric units dealing with children with kidney problems. But
right.
You name majority of med-surg type of units, ICUs, transplant units.
One we might be missing is the actual outpatient nephrology setting, meaning you're working in like a physician's office.
True.
So there are probably now more than ever what we call CKD clinics. So these are patients who have had some relationship with the healthcare environment, maybe a PCP who's been seeing them and kind of monitoring their kidney disease. And now they're getting a referral to nephrology to be evaluated to make sure we're doing everything we can to retain that renal function as long as possible before the patient would need dialysis treatment or start considering a transplant. Giving them good education around nephrotoxic drugs and what type of diet to follow and things like that. So a CKD clinic in the outpatient setting, if that's something that you're interested in, that would be another entry-level job to consider. But the thing is, if you aren't sure, like you're at this intersection where you might be interested in just about everything, choosing to go a medical unit will give you exposure to a lot of different disease processes. And you'll kind of just figure out what you really like. I mean, essentially, that was the decision I made. And I knew that I started to develop this, desire to do quality improvement for full time. But I really love the CKD population. It just changes everything about staying plugged into this particular specialty. So consider that too, how you develop relationships with patients and what you find to be most fulfilling in your career. So let's talk a little bit about pediatrics. One thing I will say about pediatrics is it's a very small population in this kind of conglomerate of a kidney disease in its entirety. So if you're looking for something that's specific to pediatrics, you might not see a lot of opportunities like just in nephrology, depending on the size of your city. That's kind of the big take-home message here is depending on where you live or where you're looking, you might not see a lot of nephrology-specific careers in pediatrics. As you get to bigger cities, you might see more kind of specialized areas in that particular subspecialty. But as far as, going into a general pediatric role, you may get some exposure to children who have kidney disorders, and that might, open this opportunity. Again, everything is a trajectory, you might get that initial experience and then say, hey, I really love pediatrics, but what I really love is the pediatric population with kidney disorders. Not that I love that they have this, but kind of like one of our colleagues was saying, her son had that experience and that's what made her go that same route. So something to consider if you're interested in pediatrics. Let's go back to our chat. Can you discuss the interdisciplinary team who you normally work with in order to help patients? Well, Jami, do you want to take this one? I feel like I've been blah, blah, blah.
Sure. So really for the interdisciplinary team, you have a nephrologist, or you might have, a nephrology nurse practitioner. So like I mentioned, depending upon your state, that nurse practitioner might be an FNP, primary care, or an acute care nurse practitioner. So you have those. You also have the nephrology nurses who provide, care for the patients. Then you also have a social worker. They might be dealing with such things as, let's say, for example, maybe CKD patients, might have problems with depression, sexual health. I'm just kind of going over a few chapters that I'm doing even now on CKD. So that's kind of how I'm reflecting regarding the depression and sexual health. But also you have, case managers regarding interdisciplinary. So those are some of your primary ones. So you have nephrologists, nurse practitioners, the nurses, social workers, and case managers. An interdisciplinary team, just like you would in the hospital, but you still have the same people in the dialysis setting.
Right. Here's something you will see different. That is very different in the outpatient setting. So if you're doing clinicals in the inpatient setting, you're familiar with CNAs and essentially technicians. Sometimes we call them different things, but it's essentially the CNA role in the nephrology setting. In the hemodialysis setting specifically, you will have patient care technicians. Mm-hmm. They are the worker bees of the unit. So they actually are doing a lot of the technical jobs of the dialysis session. They actually spend the most time with the patients outside of the nephrology nurse, because the dialysis nurse is actually doing a little bit higher level critical thinking skills that a technician could not do. It requires that you have some kind of licensed formal training. Most PCTs, as we call them, are certified, but they don't hold a license. There's a difference between those two things. And so you will see PCTs in that setting as well. Sometimes PCTs train nurses too, which is interesting environment to work in. The other thing that you will see that will be different if you're comparing outpatient hemodialysis to an inpatient setting is the doctor is not always there. There is not always a physician in the outpatient setting. There's also not always even a nurse practitioner or a mid-level advanced practice provider in the setting as well. Everyday crew is the nurse, the techs. You'll usually have a nurse manager. Sometimes they won't always be in that unit if they're covering multiple units. Your dietitian and social worker will usually have a home base, but that might not be your unit either. And so they will kind of float between a few units. So that's really the core group. You also have biomedical technicians who are responsible for really the technical and equipment environment aspect of the dialysis setting. And again, they may float between multiple units as well. But the doctor will round, and everyone knows exactly when they're coming. It's a scheduled thing. And they will see the patients, kind of check in, make any changes to the dialysis prescription if it's necessary, or other things might be going on with the patient. And you'll have these interdisciplinary care team meetings. It's scheduled usually if it's going to be a patient care planning meeting. But all that to say, there is a difference between the inpatient and outpatient environment in dialysis, which is what one of our colleagues was saying around the teamwork environment. I think, that is why that becomes very strong in the outpatient setting, because you have to rely on who is there to meet all of the demands of the job on a day-to-day basis. And so you become a very core team to make that happen. So one of our colleagues was saying that in the hospital-based dialysis center, they do take new graduates. I have actually seen this in a number of times now where there is training provided for new graduates that's going to be very specific to transitioning into a acute role that's either running in the ICU, so like doing CRRT, or even like going into acute dialysis in the inpatient setting. And so I hope to see more of that as well. Because, Jami, you know this, in the bachelor training nursing degree, there is very little on dialysis. Yeah. Do they go into it?
Actually, the ones that I teach do not. Yeah. That's a whole nother issue, but yeah.
Right. A lot of that is clinical space. When I was in nursing school, we did rotate one day through an inpatient setting, but that was it. Other than what we learned in our actual curriculum, that was all we got to see of dialysis.
Yeah, and I would say regarding from the ICU setting, if I have students who are in the ICU with me, I show them the CRRT machine, from the acute standpoint. And I do know even some schools in their community health course that they go to the dialysis clinic for that course, for their clinical component. So I guess for each school, it varies.
Different. Okay, well, let's see if there might be another question. Where do I start if I want to be a nephrology nurse practitioner? So here's the interesting thing about nephrology nurse practitioners. There is also, one of our questions was describing the CNN, which is the certified nephrology nurse. We also have the CDN, which is certified dialysis nurse. There is a certified nephrology nurse practitioner certification. So if you're in your master's program going through the nurse practitioner role, you can go any route. I have a colleague who did the acute care nurse practitioner. She practices as a acute care nephrology practitioner. Essentially, she's home-based with a nephrology practice, and she just sees the patients who are admitted, who require some level of dialysis with her team, and she rounds on them in the acute setting. I also have another colleague who is the nurse practitioner in the nephrology setting, who just sees patients in the outpatient environment. So as they're coming into CKD clinic, and then we'll go and rotate to see them in the actual dialysis setting on behalf of the nephrology team. There's a lot of variety of ways to do nephrology nurse practitioner work. Big practices. Here's another interesting thing happening in dialysis today. There's a federal executive order for advancing American kidney health where there are these new goals and federal initiatives to kind of change the way we provide kidney care in America. So since the 70s, when the Social Security Act was amended to cover dialysis in the United States, prior to that, there used to be these essentially councils that were held to decide who was going to receive dialysis treatment because it was so expensive. Medicare started paying for it, as a covered expense. You still have a 3-month waiting period to be eligible for Medicare, but regardless of that, the actual offerings and treatment have not changed dramatically since the 70s. And if you were to compare kidney care to things like cancer care or cardiovascular disease care, there has not been a lot of innovation in treatment modalities. Essentially, we've had peritoneal dialysis, which is less than 10% of the population will use some form of home dialysis, home hemodialysis, or peritoneal dialysis. So that means the majority of the population is going to in-center hemodialysis at least 3 times a week for 3 to 4 hours. And you're kind of tied to the schedule, which isn't always, what the patient really wants. Is just what's available. So you'll see a lot more of these transitional care units starting to pop up where it's actually facilitated in a outpatient setting. And the idea here is that you are exposing in-center patients to home dialysis, because truly the only way to go home is to make the decision to go home. But you don't see it. You don't get to see what it looks like until you say, yes, I want to do it. And they take you to home training. And then you kind of feel like you might be bound to that decision without the ability to just kind of observe it and see how it goes. So transitional care tries to break down essentially this like observability of doing that. And so I think our colleague is talking about how the nurse practitioners will be over that particular unit and managing how patients come into that unit. Essentially, they will often come directly from like the CKD clinics into transitional care unit and then go to home from there. Also, CKD or pre-dialysis settings for nurse practitioners, right? So in those CKD clinics, you can be a nephrology nurse practitioner in those units as well, usually tied to a nephrology practice. Also could be associated with like a large academic health center or a big, large health system. You'll see CKD clinics in those areas as well. Definitely good fits for nurse practitioners to get some like care coordination experience and disease prevention as well. I think I gave 2 examples around different types of nurse practitioners. Another one is adult primary care nurse practitioners. You could also go the geriatric route. There are lots of nurse practitioner subspecialties you can do today, but they would all relate to nephrology in some capacity. Essentially, you would get, like you do in nursing school, this kind of more generalized formal education. And then, as you choose your rotation sites, but you might have more latitude in the nurse practitioner setting to say, hey, I'm really interested in nephrology, would like to rotate in an area that emphasize that. There's probably some restrictions on that, but kind of like you do in your last rotation of the bachelor program, going into something you're kind of interested in, have that same kind of opportunity. So Jami, we might be out of questions. I don't see anything else happening in the chat. Anything else you want to share with the students as like a take-home message?
I would just say, follow your passion. My passion, I might didn't start in nephrology, but I'm in it in nephrology. I love it. I love teaching my students, either be in the actual classroom setting, the clinical setting, doing research, writing about it. Nephrology, to me, is truly my passion.
I would echo that. I would definitely say that, especially now, like there's never been a time like today to work in the nephrology setting, given like the federal push around the way that we provide care. The patients are getting more engaged than ever. There are real advocates changing the patient trajectory of their life. If you have this experience and it changes your life and you get the opportunity to get a kidney transplant, essentially it gives your life back to you. And then you turn around and try and help someone who's going through that same journey that you just went through. I don't know that exists anywhere else. I know that we do transplants and heart transplants and all these other organs, but how are they retained, to influence the population behind them? It's something else different in nephrology for sure. Sometimes it's really hard to describe until you're in it, when you can really see. It's actually miraculous, to be honest. But that's our experience in nephrology. Clearly, we really love it. Let's see, one last question. Are there any free resources in nephrology available to provide more education? So we did point out that CKD resource. I would suggest that. The other thing I would suggest is the core curriculum. I don't know that is free. I think that is probably a fee, but worth your while if you're very interested. Janet, do students have access to some of the, what would be like in the library for ANNA, any of those resources?
I believe members have access to content, so you can watch sessions. You would pay, though, if you want contact hours, which students usually aren't primarily interested in initially, so it's a great way to get content. I wanted to give one last plug to the scholarships to our national meeting for ANNA's National Symposium, which is on May 2nd through 5th. And that allows a student to be present for the entire virtual conference. And you would have access to all of the sessions. And if what you heard tonight about nephrology piqued your interest, if you want to know more, you will certainly get it during that conference. In addition, you'll have access online to those sessions for a very long time to come. And as you're going through your career, you can come back and refer to them. So we would love to have you there with us. There's always a robust chat during the virtual meetings, so you can be asking questions and getting input the entire time that you're there. We love our students, so we would welcome you sincerely. The scholarships as well as the free membership. So anything that you would be interested in, you can find it at ananurse.org/students with an S on the end. Thank you all. Thank you, Jami and Amber, for all the information you so willingly shared and for this presentation. Thank you to all of you who have joined us. And with that, we'll say good night.
Nephrology Nursing Perspectives is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. Jami Smith Brown is an assistant professor in the College of Nursing at the University of Tennessee Health Science Center in Memphis, Tennessee. Dr. Brown holds national certification as a certified nephrology nurse. Dr. Brown is an active member of the American Nephrology Nurses Association and other national organizations. She is the leader of ANNA's Educator Specialty Practice Network, serves on ANNA's Leadership and Research Committee, and is a member of the Manuscript Review Panel for the Nephrology Nursing Journal. Dr. Amber Paulus is a registered nurse and health services researcher whose research endeavors focus on evaluating the quality of healthcare delivery, healthcare outcomes, and quality improvement initiatives among individuals with kidney disease and providers of transplant and dialysis services. She currently serves as the Director of Data Science at Quality Insights, driving the organizational strategy for data initiatives. Through her role at Quality Insights, she also leads research projects focused on evaluating the 5-Diamond Patient Safety Program concerning several components of patient safety among dialysis providers, including emergency management, identifying barriers to home dialysis and kidney transplantation utilization, and the screening and management of the novel coronavirus COVID-19. Dr. Paulus serves as the chapter president of the Old Dominion chapter of the American Nephrology Nurses Association, chair designee of the ANNA Research Committee, and is a member of the ANNA Leadership Committee. This episode was originally published in April 2021 as the first episode of the American Nephrology Nurses Association's Way into Nephrology Nursing webinar series. This series is available on the association's YouTube channel and at annanurse.org. For archived episodes of Nephrology Nursing Perspectives and to learn more about the American Nephrology Nurses Association, visit annanurse.org. You can also subscribe to this podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.